If you are over 60 and your morning blood sugar keeps rising, the problem may not be dinner, stress, or even your medication. Sometimes it may be the banana you thought was harmless, especially if you eat it very ripe, by itself, in a smoothie, or late at night. A banana is not a candy bar, but after 60, it is not a free food either. Hello, I'm Dr. Claire Bennett. Today I want to make bananas simple because many older adults are stuck between two confusing messages. One person says, bananas are natural, so eat them every day. Another person says, bananas are sugar, so never touch them. Neither answer is careful enough. Before you stop eating bananas, or before you keep eating one every morning without thinking, stay with me until the end. I will give you a simple 4-word banana rule you can remember tomorrow morning. Half, firm, paired, and tested. That little rule may help you enjoy the fruit without letting it quietly work against your glucose. Let's start with what is really inside one banana. A medium banana, about 118 grams, has about 105 calories, 27 grams of carbohydrate, 3 grams of fiber, and 14 grams of total sugar, with no added sugar. That matters because your blood sugar does not rise only from white sugar. It rises from digestible carbohydrate, and a banana contains digestible carbohydrate even though the sugar is natural. This is where many seniors get caught. They say, "Doctor, I only had a banana and coffee." But in diabetes meal planning, one carbohydrate choice is often counted as about 15 grams of carbohydrate. The CDC lists one extra small banana, about 4 inches long, as one fruit carbohydrate choice. So a normal medium banana can be closer to 2 carbohydrate choices than a tiny snack. That does not make the banana bad. It means the banana should be counted. And after 60, counting matters more. Your body may not handle carbohydrate as quickly as it did at 40. You may have less muscle than before, and muscle helps store and use glucose. Your sleep may be lighter, your walks may be shorter, your liver may release glucose overnight. You may be taking medications that affect appetite, kidneys, water balance, or glucose control. If you have prediabetes or type 2 diabetes, your insulin response may not move glucose out of the blood as smoothly as it once did. So the useful question is not, are bananas good or bad? The useful question is, what kind of banana, how much, at what time, with what meal, and for which body? Let me slow this down because this is the part I want you to remember. For blood sugar, the banana itself is not always the problem. The pattern is the problem. A small firm banana eaten after a protein-rich breakfast may behave very differently from a large brown-spotted banana eaten alone before bed. A few banana slices over plain yogurt are different from a banana blended with juice, honey, sweetened yogurt, and oats. The fruit may have the same name, but your glucose response may not be the same. The first detail is size. Do not judge a banana by how innocent it looks. Half a medium banana is very different from one large banana. If you have prediabetes or diabetes, the safest starting point is often not a whole banana, it is half. Not because half is magic, but because it reduces the carbohydrate load while still giving you the taste, texture, and nutrients. The second detail is ripeness. A greener banana contains more starch, including resistant starch, which is digested more slowly. As the banana ripens, the starch changes and the fruit tastes sweeter. That is why a soft banana with brown spots can taste almost like dessert. It has not become poisonous, it has simply become faster and sweeter for the body to handle. Diabetes Canada's Glycemic Index Guide explains that the glycemic index ranks carbohydrate-containing foods by how much they raise blood sugar after eating. In that guide, green unripe banana is in the low glycemic category, Ripe yellow banana is in the medium category, and brown, overripe banana is in the high category. So ripeness is not a tiny detail. It can change how the banana behaves in your body. The third detail is what you eat with it. A banana eaten alone enters the meal almost like a carbohydrate dose by itself. A banana eaten with protein, such as plain Greek yogurt, cottage cheese, eggs, or another balanced meal, usually behaves more gently. The protein does not erase the carbohydrate, but it slows the meal and helps you feel full longer. Now let's make this very practical. If you have prediabetes or type 2 diabetes and you want a banana tomorrow morning, do not pick the largest banana on the counter. Choose a smaller banana or take a medium banana and cut it in half before you begin. Put it on a plate, move the other half away. Do not peel the whole banana and hope you will stop halfway, because most people do not. The first safe action is not in your stomach, it is on the cutting board. Then look at the color and texture. If the banana is soft, heavily spotted, and smells very sweet, do not eat it as your first test banana. Choose one that is yellow and firm, ideally with a little green near the stem. You do not need it hard and unpleasant. You simply do not want the dessert-like banana as your everyday blood sugar experiment. Next, do not eat it alone. This is the mistake I see constantly. A senior wakes up, takes medication, drinks coffee, eats one ripe banana, and believes breakfast was light and healthy. It may be light in calories, but for blood sugar, it may be a quick carbohydrate meal without enough protein to slow it down. A better action is simple. Put half a firm banana into a small bowl of plain Greek yogurt, or eat half a banana after one boiled egg. Or slice half a banana over unsweetened oatmeal, but only if you are not also eating toast, jam, juice, and cereal in the same meal. Or eat half a banana with cottage cheese. If your kidneys are healthy and your clinician has not restricted potassium, a small amount of nut butter may also be used, but kidney patients should ask first. Here is the order I prefer for many people. Start with the protein first. Take a few bites of egg, yogurt, cottage cheese, tofu, fish, chicken, or whatever protein is already in your meal. Then eat the banana slowly as part of the meal, not as the whole meal. This order does not make carbohydrate disappear, but it helps the banana stop acting like a lonely sugar source on an empty stomach. Now think about the rest of the plate. If breakfast already has toast, jam, cereal, milk, orange juice, and then a banana on the side, the banana is not the only problem. The stack is the problem. Too many carbohydrates have been placed together, so choose. If you want banana, skip the juice. If you want banana, do not add jam. If you want banana, consider one slice of toast instead of two. If you want banana, do not also pour a sweet cereal into the bowl. The banana should replace another carbohydrate, not sit on top of all the others. This one idea helps many older adults. The banana needs a job. It should not be an extra. Now let's talk about timing. For many people with prediabetes or type 2 diabetes, the easiest time to test banana is earlier in the day with a balanced meal or near activity such as walking, gardening, chair exercise, or physiotherapy. Muscles use glucose more actively around movement, so a small portion may fit better there. The more risky pattern is a large, overripe banana eaten alone late at night, especially if your morning fasting glucose is already high. This does not harm everyone, but if you wake up again and again with high readings, you should test the pattern before blaming everything else. Try this for 1 week. Do not eat banana at night. If you want banana, have half of a firmer banana earlier in the day with protein. Write down your morning glucose, then compare. You are not punishing yourself. You are learning your body. If you have a glucose meter or a continuous glucose monitor, here is the most useful test. Check your glucose before the banana meal. Then check again about 2 hours after eating. Write down 3 things: how much banana you ate, how ripe it was, and what you ate with it. For example, write half firm banana with plain yogurt, or whole ripe banana alone, or banana smoothie with juice. After a few tests, many people can see the pattern clearly. The whole ripe banana alone may raise glucose more. The half-firm banana with protein may be much easier on the body. Diabetes Canada's guide also says that checking blood sugar before and 2 hours after a meal is the best way to know how your body handles certain foods and drinks. And that is important because your neighbor's response is not your response. Your spouse's glucose pattern is not yours. Your body is the one we are trying to understand. Now, if your 2-hour number is higher than your clinician's target, do not panic. Adjust. Next time, try 1/3 to 1/2 banana instead of a whole one. Choose a firmer banana. Eat protein first. Avoid juice and honey. Do not eat it late at night. And do not add it to a meal already full of starches. This is how a person with diabetes can often include banana more safely. Smaller amount, less ripe, paired with protein, not stacked with other carbohydrates, not blended with added sugars, and tested when possible. Let's look at common mistakes more closely, because this is where many people hear the advice but still do the old habit. Mistake 1 is the banana and coffee breakfast. It feels light, but it may not be steady. Coffee and a ripe banana may leave you hungry again by mid-morning, and your glucose may rise without enough protein to support you. A steadier version is half a firm banana with plain yogurt and an egg, or half a banana after a small, balanced breakfast. Mistake 2 is the healthy smoothie. This is one of the biggest traps. A smoothie can look clean and fresh, but one whole banana, a cup of juice, flavored yogurt, oats, honey, and dried fruit can become a large carbohydrate drink. The blender also removes the natural pause of chewing. You can drink in 2 minutes what you would never calmly eat from a plate. If you enjoy smoothies, use half a banana, avoid juice and honey, choose unsweetened yogurt, add protein, and keep the portion modest. Mistake 3 is the bedtime banana. Some people eat it because it is soft, sweet, and comforting. But if your morning number is already high, that late carbohydrate may be part of the story. Again, do not guess. Test. Move it earlier. Cut the portion. Pair it. Watch the morning number. Mistake 4 is treating every weak or shaky feeling with a banana. Sometimes shakiness is low blood sugar. Sometimes it is dehydration, low blood pressure, missed meals, medication timing, infection, anxiety, or a heart rhythm problem. If you have diabetes and your glucose is truly low, follow your low blood sugar plan. But if you keep eating bananas for every week spell without checking, you may raise glucose repeatedly while missing the real cause. Mistake 5 is forgetting the kidneys. This is especially important after 60. Bananas are known for potassium. Potassium is important for nerve, muscle, kidney, and heart function. The NIH explains that potassium is needed for normal cell function, including nerve transmission and muscle contraction, and it is closely linked with sodium balance and blood pressure. The DASH eating pattern, which is rich in fruits and vegetables, lowered systolic blood pressure by about 5.5 mmHg and diastolic blood pressure by about 3.0 mmHg in a major clinical trial. But potassium is helpful only when the body can handle it. The American Kidney Fund lists one medium banana as a high potassium fruit with about 422 milliliters of potassium. The National Kidney Foundation explains that people with kidney disease may need to watch potassium, and foods with more than 200 milliliters per serving are generally considered higher in potassium. So if you have chronic kidney disease, high potassium, heart failure medication, ACE inhibitors, ARBs, spironolactone, eplerenone, or potassium-sparing diuretics, do not make bananas a daily habit without asking your clinician. Please hear me carefully. Do not stop your medications because of a banana video. Those medications may be protecting your heart, kidneys, or blood pressure. The safer action is to ask your doctor, pharmacist, or renal dietitian, is banana safe for my potassium level and my kidney function? Now let's divide this into groups because after 60, nutrition advice should not pretend that everyone is the same. If you have normal blood sugar, healthy kidneys, and regular activity, bananas are usually reasonable as one fruit among many. Variety still matters. Some days, banana. Other days, berries, apples, pears, oranges, peaches, or melon. Healthy aging is not built on one perfect fruit. It is built on a pattern. If you have prediabetes, bananas are a measure and pair food. Start with half a medium banana. Choose firm rather than very ripe. Eat it with protein and watch how you feel. If you have a meter, check the 2-hour response. You are not trying to become afraid of food. You are trying to prevent a small daily habit from becoming a daily glucose problem. If you have type 2 diabetes, use personal feedback. Some people can eat half a banana with yogurt and stay within target. Others see a spike even with a small amount. Medication, insulin resistance, stress, sleep, activity, liver glucose release, and the rest of the meal all matter. The best question is not, can a diabetic eat bananas? The best question is, what happens to my glucose when I eat this amount, this ripe, this way? If your A1C is above target, your fasting glucose is frequently high, or you often feel sleepy after breakfast, start smaller. Try 1/3 or 1/2 banana. Avoid overripe fruit. Eat protein first. Do not blend it with juice. And if you take insulin or a medication that can cause low blood sugar, do not make big carbohydrate changes without knowing how they fit your medication plan. If you have kidney disease or high potassium, the main question may be potassium safety rather than blood sugar. Ask directly. Do not rely on a neighbor who says bananas are good for cramps. Cramps can happen for many reasons, and more potassium is not always the answer. For some kidney patients, apples, berries, grapes, or canned peaches may be safer options, but the right choice depends on lab results and your kidney diet plan. If you are frail, losing weight, skipping meals, or struggling with appetite, the conversation changes again. You may need nourishment, not more restriction. In that case, banana can be helpful because it is soft, familiar, inexpensive, and easy to eat. But pairing still helps. Half a banana mashed into plain yogurt, oatmeal with a few banana slices, and an egg on the side, or a small banana after a protein food may support steadier energy better than banana alone. Let me also describe the plate, because this is the easiest way to picture it. Imagine your breakfast plate in front of you. On one side, you have your protein, an egg, plain yogurt, cottage cheese, tofu, or a small portion of fish or chicken, if that is your usual breakfast. On another side, you have a small carbohydrate choice, such as one slice of whole grain toast or a small serving of oats. Then the banana is not another full meal sitting beside it. It is a few slices or half a banana used for sweetness. Now imagine the unsafe version. The plate has toast, jam, cereal, milk, juice, and a whole ripe banana. Nothing there is evil by itself, but together the meal becomes crowded with carbohydrate. Many seniors do not realize this because each item looks normal, but blood sugar does not judge foods one at a time. It responds to the total amount, the speed of digestion, and how empty or full your stomach is. There is also a difference between chewing and drinking. When you chew half a banana slowly with yogurt, your brain has time to register the meal. When you drink a smoothie, the fruit enters quickly, and you may still feel as if you only had a drink. This is one reason I am more cautious with banana smoothies than banana slices. And please do not turn this into shame. If you have been eating bananas in a way that raises your glucose, it does not mean you failed. It means nobody explained the pattern clearly enough. Once you see the pattern, you can change the habit without losing the food completely. Let me give you 3 real-life pictures. Margaret is 72 and has prediabetes. She eats 1 ripe banana with coffee every morning. By 10 o'clock, she feels hungry and tired. We do not ban bananas. We change the pattern. She cuts a medium banana in half, chooses a firmer one, eats it with plain Greek yogurt and a boiled egg, and takes a short walk after breakfast. The banana is still there, but now it is part of a steadier routine. Paul is 68 and has type 2 diabetes. He makes a smoothie with banana, orange juice, sweetened yogurt, oats, and honey. He calls it healthy because it has fruit. But his mid-morning glucose is high. For Paul, the problem is not just the banana, it is the stack. We remove the juice and honey, use half a banana, choose unsweetened yogurt, add protein, and sometimes use berries instead. He feels less blamed because he finally understands what changed. Evelyn is 80 and has chronic kidney disease. A friend tells her bananas help leg cramps, so she starts eating 2 every day. At her next blood test, her potassium is high. For Evelyn, the risk is not mainly natural sugar, it is potassium. She needs a kidney-safe fruit plan from her healthcare team. These examples show why a one-word answer fails. One person needs a smaller portion, another needs to stop blending sugar, another needs potassium guidance. The food is the same, but the body is different. Here is the final banana plan I want you to remember. First, choose firm. A yellow banana with a little green is often a better blood sugar starting point than a soft brown spotted banana. Second, cut first. Put half on the plate and move the other half away. Do not rely on willpower after the peel is open. Third, pair it. Eat it with protein or as part of a meal. Yogurt, egg, cottage cheese, tofu, fish, chicken, or another protein food can help the snack feel steadier. Fourth, replace, do not stack. If banana is in the meal, remove another carbohydrate such as juice, jam, extra toast, sweet cereal, honey, or dessert. Fifth, avoid the smoothie trap. If you blend it, keep the portion small and avoid juice, honey, sweetened yogurt, and dried fruit. Sixth, time it. If your fasting glucose is high, test banana earlier in the day rather than late at night. Seventh, check if you can. A before meal and 2-hour after meal reading can teach you more than a general rule on the internet. And eighth, ask about potassium if you have kidney disease, high potassium, or medications that affect potassium. Before we close, let's clear up the myths. Fruit sugar counts. Whole fruit is usually better than candy or juice, but carbohydrate from fruit still affects blood sugar. The American Diabetes Association notes that fruit contains carbohydrate and should be counted as part of a diabetes meal plan, while fresh, frozen, or canned fruit without added sugars can still fit into diabetes eating. Bananas are not forbidden for everyone with diabetes. Many people can include them in a measured portion. Brown bananas are not rotten simply because they are brown, but they are usually sweeter and faster to digest. Banana bread is not the same as banana. Banana bread often contains flour, sugar, and fat, so your glucose may experience it more like cake than fruit. And potassium is not automatically safe just because it comes from food. For healthy kidneys, potassium-rich foods can fit well. For kidney disease, high potassium, or certain medications, you need personal guidance. So here's the safest conclusion. After 60, bananas can help when they are measured, firm enough, paired with protein, timed well, and matched to your kidneys and medications. They can hurt when they are oversized, overripe, eaten alone, blended with added sugars, eaten late at night on top of high fasting glucose, or used casually when potassium is a concern. You do not need to fear bananas, but you do deserve to understand them. The next time you see a banana on the counter, do not panic and do not ignore it. Look at the size. Look at the ripeness. Ask what you are eating it with. Ask when you are eating it. If you monitor glucose, let your own numbers teach you. If this helped you understand your blood sugar more clearly, subscribe to Dr. Claire Bennett for calm, practical senior health guidance you can actually use. And remember the 4-word rule: half, firm, paired, and tested. That is the safer banana rule after 60.